Hey team, it's your nurse educator Amy, and today we're going to be talking about the components of an EVD. Now, an EVD is placed to help drain off CSF in an attempt to lower the pressure or the ICP in the brain. The higher that ICP is, the less likely blood is able to circulate, and that can really put the patient at risk for ischemia. Not good. So typically what happens is the neurosurgeon is going to drill a hole in the cranium of the patient and then insert a catheter into the lateral ventricle of the brain. It's the ventricles that are responsible for the production of CSF. So this is how we're going to be able to access the CSF, drain it off of the patient, and then lower the pressure in the brain. Now, that catheter is going to be attached to pressure tubing that then connects to the drain itself. Now, this portion of the pressure tubing does have a sampling port that the providers can use to instill medications as needed, but that's only for the providers, not for us. This is also an option that we can use to sample CSF to send to the lab, but you would only use this port if it's part of your unit policy on EVDs. The other option that we can use for CSF sampling is this port over here that's directly under the buretrol. So please make sure that you're looking at your unit policy on EVDs so that you know which one you would be using. Now, the next part that we come to on the EVD is our series of 2 stopcocks, and we're going to be using this a lot when we're managing our EVDs. Now, the first stopcock is directly onto the transducer itself, and this is the one that we're going to be manipulating to zero the EVD. That's really going to be the only time that we touch stopcock number 1. Now, stopcock number 2 is going to be the stopcock that we're going to be manipulating to either drain off CSF or clamp off the drain. That tubing then goes to the buretrol, or the actual collection chamber of the EVD where that CSF is going to lie. Now, again, depending on your orders, we'll typically be emptying this buretrol every hour, okay? And then this stopcock over here, stopcock number 3, is the one that we're going to be manipulating to drain the CSF from the buretrol into the bag. I like to think of this section as kind of like a Foley catheter. The buretrol is very similar to the uremeter that you can dump into the Foley bag, right? Now, this portion of the EVD right here, this is the scale that we're going to be setting the buretrol to depending on the orders that the provider enters in. Now, on this scale, I have 2 sides. One side is set to millimeters of mercury, and the other side is set to centimeters of water. And they are different. The numbers don't quite add up. So it's important to be able to look at the provider's orders so that you know which side you're going to be using to set your drain to. Now, this is a very important principle with the EVD drain. The higher the number that we set the drain to, the less CSF drainage there will be. The lower the number that I set it to, the more CSF drainage there will be. And what this number represents is an ICP reading. So for instance, if I have orders to set my drain to 10 centimeters of water, what that means is anytime the patient's ICP reading gets above 10 centimeters of water, it's going to promote drainage of CSF into the buretrol until the patient's ICP gets back to 10 centimeters of water. So again, the higher the number that I have that drain set to, the less CSF drainage I'm expecting, and that typically means the patient is improving. The lower the number that I have it set to, the more drainage I would be expecting, and that typically means the patient still needs a lot of intervention to help get that pressure under control. It's not uncommon when we first place these to have orders to put the drain to 5, 0, sometimes even -5 in an attempt to drain off a rapid amount of CSF so that we can help get that pressure under control and reduce the risk of ischemia. So remember, always check your unit policies and your provider's orders so that you know what to do with your EVD drain. I'll see you in the next video, guys. Make sure and like and subscribe so you don't miss any of my videos. Thanks!